Hello, good afternoon, and welcome to everybody. And a special good afternoon to our guest, His Excellency, the Honourable Minister for Industry, Trade and Investment, Bani Adebayo. I'd like to thank him for accepting our invitation. My name is Dr. Ola Brown. I'm a medical physician and an entrepreneur, and also an investor in the healthcare, particularly in the healthcare space. And today, I'm going to be talking about the link between trade, investment, and healthcare. So I'm just going to put up my slides. I hope everybody can see. So I'm going to start this presentation with a story about when I was in medical school. And I thought that, sorry, my slides aren't going through. I'll just share the screen again. Hopefully I'll be lucky at this time. Okay, perfect. Can everybody see?
Yes.
Okay. So one of my proudest achievements in medical school was almost completely memorizing the Krebs cycle. The Krebs cycle is a metabolic pathway, and it shows how energy is created in a cell. And I thought that mastery of the Krebs cycle was the one thing that was going to make me a healthcare titan in this world. I spent my time to memorize all the complex structures of all the proteins and all the conversions and every single step. And, you know, it was my proudest moment because I thought I had conquered healthcare and healthcare systems by committing this to memory. So imagine my surprise when Bill Gates came to Nigeria and said that he wanted to conquer healthcare in Nigeria. He wanted to fix healthcare in Nigeria. And the people that he called to help him fix healthcare were not people that had memorized the Krebs cycle. Neither were they people that had read anatomy and physiology and pharmacology like me. Neither were there people that had spent hours painstakingly pipetting stem cells in a biosafety cabinet and experimenting on mice in Tokyo and painstakingly documenting research results. They weren't even doctors. When he wanted to fix healthcare and healthcare systems in Nigeria, the people that he considered qualified and the people that he decided to take on this journey were two bankers and a cement producer. Why? Because he recognized something that I've grown to recognize over time. And he recognized something that I think a lot of people, especially doctors, tend to miss. He recognized that healthcare isn't a purely philanthropic effort. It isn't charity work. And science is a really, really small part of actually building an effective healthcare system. You see, healthcare is an investment, not a cost. Healthcare is trade. Healthcare is industry. And healthcare is business. Bill Gates recognized it a lot earlier than I did, but I think that he kind of changed my journey and the way I thought about healthcare. And I went from attending cardiology conferences and attending emergency conferences to beginning to phase out my clinical practice and transitioning into finance, transitioning and building my company in terms of our healthcare portfolio, and then also beginning to make investments in other companies. So 10 years on, almost 10 years on from that point, the Flying Doctors Investment Company has three main divisions: our consulting, training and technology division, our aviation division, and our hospital and infrastructure division. And we also have investments in almost every area of the healthcare value chain, from diagnostics to retail pharmacy, to logistics, to telemedicine, to EMR, to biotechnology, to manufacturing of drugs and chemicals. And I think it was seeing those pictures and seeing that event that really was my turning point, when I realized that to build healthcare systems, investment and industry are important. And it's something that I think a lot of people don't even think about when they think about the Ministry of Trade and Industry. When people think about trade and industry, they think about cars, they think about cement, they think about petroleum products, they think about refineries. They don't think about humble healthcare. And that's something that I hope by the end of this webinar, by the end of this presentation, something that I hope might change. So this is quite a busy slide. I call it healthcare at a glance, because on a single slide, I've aimed to show the opportunities in Nigeria and across Africa for healthcare, but also some of the challenges. And if you look at the top left corner, there's a graph that shows the number of nurses for every 10,000 people. And looking at the bottom, you can see that the United States has almost 10 nurses for every 10,000 people. In the UK, it's 9. In Dubai, it's about 7. In India, it looks like it's about 3. And in Nigeria, it's 2. So from a personnel perspective, Nigeria has its challenges in terms of the number of healthcare, the amount of healthcare expertise available in terms of doctors and nurses, physiotherapists, pharmacists. Our numbers are quite low, and that's definitely a challenge. When we go down from that slide and look at the neonatal mortality, that's the number of babies that die in Nigeria. We can look at Sweden in the green, the deeper green, and that's very low. You can look at Brazil, a fellow emerging market, in navy blue, and you can see that that's slightly higher. In the United Kingdom, sky blue, that's a lot lower than Brazil. And then we go up a bit to China in the pink. And South Africa looks pretty high in the light green. But Nigeria stands out in the orange as one of the countries in the world with the highest, or one of the highest numbers of babies that die. And that's definitely a problem. If we go to the bottom right-hand corner, it looks at first glance that we're doing relatively well on maternal mortality. That's the number of women that die in the process of pregnancy and childbirth, because there's a lot of countries ahead of us. Countries like Chad, countries like Somalia, countries like Burundi, countries like Sudan actually do better, do far worse than us when it comes to the number of women that die during the process of pregnancy and childbirth, and that's our maternal mortality. But if you look at all of those countries that do better than us, you can see that there are actually countries that have been affected by war or civil unrest over the past decade or more. And Nigeria actually relatively has quite a bad maternal mortality. And I mean, if you look at the countries that are doing better than Nigeria, you can see Guinea, Niger, Zimbabwe, Congo, Mozambique, Tanzania, even Afghanistan. So in terms of our healthcare indicators, we could be doing a lot better. And that's a challenge, but it's also an opportunity. The aggregate size of the world's healthcare sector is $5.8 trillion per year. That's a massive opportunity. And 70 to 90% of all the drugs we use in sub-Saharan Africa right now are imported. If you look at the top right-hand corner, McKinsey and Company predicts that the market for pharmaceuticals could reach, in Nigeria alone, could reach $4 billion by 2026. That's a very exciting opportunity. And from the perspective of our balance of trade, if Ethiopia and Nigeria were to increase their local share of production from 15% where it is now to 45%, both countries could see their trade balances improve by $200 million annually. And this is one more exciting statistic. For every single year, additional year of life expectancy, we can increase GDP per capita by 4%. So those of us that have studied economics realize that Nigeria is one of the few countries in the world where people, the citizens, have been getting continuously poorer over the past 20 years. So the share of wealth in Nigeria for each citizen has been getting lower and lower over the past 20 years. But if we can work to raise life expectancy just by a single year, by improving and investing in healthcare, then we can raise that GDP per capita by 4%, and that's a super exciting opportunity for me. I'm going to finish on the chart in the middle, which looks at India. The average cost of a state-of-the-art heart surgery in India is $1,800, compared to that same surgery in the United States, which costs $90,000. India has managed to reduce the cost of healthcare while still maintaining the quality of the healthcare that they offer. And they've done this by centralizing their healthcare around very large super specialist hospitals that provide state-of-the-art healthcare for huge amounts of people, and thereby reducing the cost. We do this in other industries, and in Nigeria, and I believe that we can do it in healthcare. Dangote is successfully able to get cement across all 36 states in Nigeria, but he hasn't had to build a factory in every single state. And in the same way, not every state needs to have a super specialist hospital, but we can take advantage of our population, we can take advantage of the volume of certain diseases that we have to make this centralization happen and bring down the cost of healthcare. So in this slide, we've looked at the challenges, workforce, deaths of children, deaths of women in pregnancy, but we've also looked at some of the big opportunities, the huge market size globally, pharmaceuticals, the effect on GDP, and also the opportunity for centralization to bring down the cost of healthcare and make it available to more people. And there's an additional advantage that I'd want to talk about, and I've dedicated a whole slide to this because this is one of Nigeria's probably most challenging issues, and that's unemployment. Jobs, jobs, jobs. That's the agenda of almost every governor in every state. People are idle, and that idleness contributes to civil unrest, it contributes to terrorism, it contributes to crime. And if we're able to create jobs, then healthcare is not just saving lives, it's helping to build our economy. In America, healthcare is overwhelmingly America's biggest source of employment. So the healthcare sector employs more people than any other sector. And in addition to the thousands of jobs created by healthcare systems, each job in the healthcare system also creates jobs outside the healthcare system. And this is evidence from the WHO that shows that on average, for every additional 100,000 euros spent on the healthcare system, 4 new jobs are created. And that's in Europe, in France, in Germany. However, in less developed parts of Europe, the multiplier is actually higher. So for example, in Bulgaria, 10 jobs are created for every $100,000 spent on healthcare. In Nigeria, because we're less developed than Bulgaria, we could estimate or extrapolate that it would be 16 to 20 jobs created for every 100,000 euros spent on healthcare. And that really excites me and really develops a strong case for investment in this essential sector. I'm going to finish off my presentation with 3 things that you might not know about trade and investment in healthcare. Number 1, 11 billion. That's the figure that Cuba made in 2018 from the export of healthcare services, according to Time magazine. Now, because of COVID, that figure will probably almost double to 16 to 17 billion from export of healthcare services in Cuba. Now, 16 billion, 17 billion might not sound like a lot of money until you look at Nigeria's oil revenues. In 2018, when the oil price was actually high, our gross revenue from oil was only 18 billion. That means that Cuba made the same amount from export of healthcare services as we made from oil and gas. Now this year, because of the effect of COVID and the effect that that has had on the oil and gas sector, we'd expect to make as Nigeria a lot less, maybe 11, maybe 10 billion from oil. So Cuba, a tiny country of just 11 million people, makes more money from export of healthcare than we make from oil and gas. And that's not all. There are other advantages. In the Cold War years, Cuba actually began to use its doctors and the export of healthcare services to countries as a diplomatic tool to overcome political isolation. So not only does it bring revenue in as the service that is offered, which is healthcare, but it also helps to open up trade doors and trade corridors for other businesses outside healthcare as a diplomatic tool. The second thing you might not know about healthcare trade and investment, Mediclinic Hospitals, a South African hospital group, has been valued at $6.5 billion and listed on the London Stock Exchange. It has hospitals operating in London, Switzerland, South Africa, and Dubai, and it's on the list of the 100 biggest companies in the UK. Last year, Dangote Cement turned over just under $2 billion in revenue. Last year, this humble hospital turned over $4 billion in revenue. So when people ask me, or people say we need to concentrate on real business that can generate revenue for the country, and they start talking about real businesses like steel, like cement, like agriculture, things that can really bring revenue and things that can generate employment, I think it's important to see healthcare as a real business that can generate employment, that can generate forex, and can generate revenue for the country, even more so than the things that we see as real businesses. My final slide. This is the top 10 companies by revenue in every state in America. CVS Health, a pharmaceutical chain, is number 6. The turnover of this group of pharmacies is $200 billion. That's half of Nigeria's GDP. And when you look at the top 10 companies, you have Walmart, supermarket, ExxonMobil, oil and gas, Apple, phones, Verizon, mobile phone network, Amazon, e-commerce, General Motors, cars. But healthcare is the only sector on this list that has 3 companies out of the 10 largest companies in Nigeria. Healthcare occupies in America, sorry. Healthcare occupies number 5 with United Health. It occupies number 6 with CBS, and it occupies number 8 with Amerisource Spurgeon. And it's the only sector to occupy 3 positions in the largest company list, which is incredible for something that we don't even think is a real business. I'm going to end with a slide from Bill and Melinda Gates, who say that every $1 they put into global healthcare funds over the past 18 years has seen a $20 return. They say healthcare has a better return financially than the American Stock Exchange. So I hope in this brief presentation, I've been able to position healthcare not just as a charitable endeavor or a philanthropic endeavor, but as a real business that is capable of providing employment for Nigeria, is capable of providing Forex for Nigeria, and is capable of making Nigerians healthier as well as wealthier. Thank you very much for listening. Now, I'd like to go on to speak to the conversation. So I'm going to stop screen sharing so you can see me again. And the minister is represented here today by Abimbola Olufore, who is the Senior Special Assistant to the Minister. Abimbola, are you there?
Yes, I am, Dr. Brown. Good afternoon, everyone.
Good afternoon, and lovely to speak to you. So
lovely to speak to you as well.
It's going to be a very brief set of questions. The first question that I wanted to ask you is, I was actually quite surprised when myself and the minister started speaking about healthcare, because the Ministry of Industry, Trade and Investment is typically associated with, you know, serious things, right? Like steel, like cement, like agriculture. I'm going to ask a question that I'm sure everybody on this webinar is curious to know. Why are you also interested in healthcare?
Okay, thank you, Dr. Brown. And on behalf of the minister, first of all, I would like to tender his apologies. He is currently in the meeting with the Vice President, and this meeting has extended, and it is completely out of his control to exit. And he sends his apologies to everybody. And on that note, I will just go ahead and answer the question. Before I answer the question again, I'm going to take you on the point from Bill and Melinda Gates, where you have said, you quoted healthcare has very, very good returns. Maybe for every $1 invested, you get a $20 return. I would actually say that healthcare has the best return that you can ever imagine, because this is going towards the human. And we are the Earth's first and best resource. So anything invested in us as a people and healthcare that's been becomes like the best of investments that you can ever have. We know that the COVID-19 has exposed fragilities in our healthcare system. And we have seen this at the national and the subnational levels. We have witnessed huge gaps in our healthcare capacity, from infrastructure to equipment, data systems, and supplies. As an important building block of national security, a robust healthcare system not only aims to provide adequate and timely medical care, but also monitors and controls the outbreak of diseases. The pandemic, as we know, has also exacerbated inequality in healthcare access. Some people can safely quarantine at home, while others can't even afford the protective equipment such as masks required and hand sanitizers, as the case is today in Nigeria. Considering these challenges, we have decided to fast-track our initial development plans of investments and promotion of healthcare. And in fast-tracking this, alongside other ministers, our minister has actually worked on the economic sustainability plan, where he advocated for additional interventions in healthcare through the Bank of Industry. The ministry has also set up a team working with the Bank of Industry, the Presidential Task Force on COVID. And this team is charged with boosting local capacity in the area of medical supplies and the production of active pharmaceutical ingredients necessary for the local manufacturing of drugs. Subsequently, this team would work with others within the Presidential Task Force, the Ministry of Health, and the Center for Disease Control to look into the manufacturing of antigen-based rapid test kits for COVID-19. We collaborate daily with agencies under the supervision of the Standards Organization of Nigeria and NAFDAC to ensure the acceleration of the issuance of certificates of standards for essential items without, sacrificing the quality of these items. Such items include hand sanitizers, coveralls for our medical workers, face masks, needles, goggles, gloves, sodium hypochlorite, and digital thermometers. However, we are not doing this only in response to the pandemic. We are ensuring that we attract investments and develop local capacity in the sector for the future so that we attain self-sufficiency. Therefore, the healthcare sector and related industries have been added to the priority sectors, not only of the ministry, but of the country at large. Thank you very much.
Thank you. One more question. The outlook of healthcare investment in Africa has, largely been looked at from the prism of, charity and philanthropy. So I think a lot of people in the audience will be curious to know, this is the Ministry for Trade, Investment and Industry. This is social work, isn't it? And if you don't believe that it's purely social, how are you looking to change that perception? And do you believe that healthcare can bring returns, financial returns, as well as social ones?
Thank you, Dr. Brown. The reality is that large segments of the healthcare value chain already deliver attractive returns to investors, like you mentioned during your presentation. An obvious one is the pharmaceutical industry. Increasingly, we also see significant trends towards profitable private sector participation in primary and secondary care and potentially healthcare logistics. This, we know, has actually been invested in and kind of like sustained and pushed by most philanthropic organizations. But right now, with our current realities, we are refocusing to ensure that we greatly enhance the acceleration of healthcare in Nigeria through public-private partnerships, but on the public level, looking at pushing things from the policy perspective, and of course, putting in place good incentives for the private sector to participate and take this away from being a philanthropic venture to actually something that is co-upheld by the public sector and the private sector at large. Thank you.
Thank you so much. I know that you've got to go because your team is very busy, but I just wanted us to take one question from the audience. And the question is specifically to do with industry. And it's by Oko Sunday. And he's asking, what's your advice for us now, Honorable Minister? Should we be importing drugs or should we try and manufacture?
So my advice is to begin to look at the COVID pandemic, not only in terms of the fragilities set into the system, but looking at it from the point of view of the opportunities, where we begin to see that healthcare logistics, for example, primary healthcare, and actually boosting local manufacturing now becomes, a very good focus. This actually is underpinned by creating opportunities for our SMEs. And we have to start to think about the best ways as SMEs, even the micro enterprises, how do we support the healthcare system? How do we become relevant in the building of the healthcare sector? So Mr. Oko?
Sunday.
Yeah. So Mr. Oko, I would advise that you begin to look as well as, alongside other peers or whatever organizations you belong to, begin to ask the questions, how do we begin to make this change and impact our economy? Because in impacting our economy, one of the things that we have to tackle is healthcare. And kudos to your presentation, Dr. Brown. That was kind of like very, very insightful. I mean, taking the cues from her presentation, you begin to see that healthcare doesn't only come from the perspective of doctors and scrubs and all that, even though we salute you, frontliners, but it also comes from looking at it from a trade and investment perspective, where you begin to question the everyday and the ordinary, what can we do to improve healthcare? Thank you.
And then there's one more question, and I'm sure you have a lot of answers to this because I know about all the work that you've been doing for the past few months on the ease of doing business. So this question is from Uyi Ima Edomwoyi, right? And the question is, what are the efforts that the ministry is making to increase the favorability of the healthcare and business environment for stakeholders?
Please, could you repeat that question?
What are the efforts being made to increase the favorability of the business environment for stakeholders?
Okay, thank you for that question, Uyi. Like I mentioned earlier in my previous statement, efforts being made is actually by Nigerian Investment Promotion Council, looking at putting in place incentives that will enable investment promotion in healthcare. Recently, through the Economic Sustainability Plan, the President approved for a large sum of money that is going to be pushed into the economy as an intervention stimulus specifically for the health sector. So this is actually going towards health infrastructure. And we know that to put in place health infrastructure, there are loads of dependencies that comes from, just the different aspects of business and trade that you can imagine. So I'd want you to probably go to the NIPC website to look at, to take a look at the compendium of incentives, and also just tune into what we're doing at FMITI, because we're going to be publishing the incentives and things that we're doing to create enabling environment for our investors in the healthcare sector. Thank you.
Okay, the last question is addressed to me, and it says, I do agree that healthcare, we should look at healthcare as a business, and the sector usually makes a healthy profit. But why are the big players especially those listed on the Nigerian Stock Exchange, not making money. And I think that this is to do with the sort of historical Nigerian business problem, which is the market size. Right now, most Nigerians pay out of pocket for healthcare. And this means that when you have a large amount of people paying out of pocket for healthcare and nobody's paying for them, let's remember that in the NHS, for instance, British people don't pay out of pocket for healthcare. It's paid for by the government. In most developed countries, they're not paying out of pocket for healthcare. Somebody, either a government-based insurance company or some sort of subsidy scheme like the Medicare and Medicaid pay for them. But in Nigeria, the market size is quite small because the payer is the patient. And even in South Africa, just 7% of people in South Africa pay out of pocket compared to 70% in Nigeria. So even within Africa, the disparity between the number of people that pay out of pocket and the number of people that are covered is quite extraordinary. So to grow the healthcare sector, we need more people entering the healthcare sector, more people taking the time to try and influence policy and work with policymakers to make the environment more enabling. And I don't know if you have anything to add to that in terms of why aren't the ones that we see making that much money if it's such a big business?
Yeah, thanks, Dr. Brown. I will concur with what you just said. We actually, just as I mentioned, we need to begin to look at all the dependencies, right, within the healthcare sector, and going from primary healthcare provision and new ways to actually do this, and also factoring in digitization of our economy and the role that plays. We have a lot of smart kids here in Nigeria that are going into IT, and looking at how do we get into that solution space where we are using the internet to actually reach remote areas, you know, like remote doctors, for example, and how do we begin to create insurance for people, for healthcare, to be able to push the agenda of affordable healthcare forward. All these are areas that can be explored in the business of health. Thank you.
Okay, there's a PhD in health, economics, and finance. So my colleague, and he's asked a very interesting question, which I'm going to try and answer, which is most successful countries of the world invest in health insurance. How do we improve our health insurance? When me and David were in California a few years ago, we were speaking to our Uber driver, and unfortunately, when you tell people you're a doctor, even if you're on holiday, they start telling you their medical problems. So there I was, like, wearing my short knicker, trying to enjoy myself, and because it was a 1-hour drive, he started telling me about his knee problem. And I discovered that he had gone to Mexico to go and fix his knee. And it was a clinic on the border between Mexico and America. And I'm like, you know, I watch Netflix, so I know that part of Mexico is quite dangerous. So I'm like, why on earth would you leave America and go to Mexico, where you can die very easily, that is not safe, just to get your knee fixed? And he told me that if he was to take out health insurance, then he would be spending almost a quarter of the money that he makes on Uber every month on health insurance. And I was amazed, like, we're in California, everything is here. You have the best doctors, Stanford University Hospital. That hospital, they spent $1 billion on it. So our entire healthcare budget, they just used it to build one hospital. I was just looking at, like, why on earth would he leave this one fantastic place and go somewhere where it's not even safe to go and get his knee fixed? But it was the cost of insurance, because healthcare is expensive. There's no two ways about it. There's expensive resources, there's doctors, there's expensive equipment that you need for the provision of healthcare. And it's very difficult to move around that fact. So I think that insurance hasn't developed here because people are poor. And you might say, okay, it has developed in India, even though people are poor. But actually, no, people are not poor in India. If you look at the number of households in India that earn $9,000 and above, there are 100 million households earning $1,000 and above. If you look at the number of dollar millionaires in Mumbai city, there are 60,000 millionaires in Mumbai city. When you look at the number of millionaires in the whole of Nigeria, there are only 12,000 millionaires in Nigeria. So when you really want to compare Nigeria to India in terms of the market, the number of people that can pay absolutely anything for healthcare and they don't care about the cost, then Nigeria actually has far fewer people with the capacity to pay than India. And we also have far more poor people than India. So India has a lot more rich people than Nigeria, full stop. But we have more poor people. So if we look at the number of people in extreme poverty that don't even constitute a real market for food, then you find that Nigeria actually has more very, very poor people than India. So the very extremely poor people in India are about 70 million, whereas in Nigeria, the extremely poor people are 90 million. So when you're comparing Nigeria to India, and I'll just put the numbers up so that everybody can see that I'm not making this up. When you look at the dollar millionaires, look at Mumbai, they're almost $60,000 millionaires, where there are just 12,300 millionaires in Nigeria. So if you're living in Mumbai and you're selling expensive healthcare, just in Mumbai, you have more people that will pay anything for healthcare than you have in the whole of Nigeria. And when you add the total number of millionaires up, it's even like the tier 2 cities, really, like Hyderabad, Pune, that you start seeing the numbers that you see across the whole of Nigeria. So Indians are far, far richer than us, and there's a far, far bigger market for healthcare. So we even have to be in Nigeria a lot more cautious about insurance because we have far, far fewer people that can afford insurance than you would see in a place like India. And we also have to think very, very carefully around our revenue as well, because India is actually very fiscally healthy. They produce a lot and their GDP is high. They make a lot of money, whereas in Nigeria, we don't. Our revenues are actually quite squeezed. Nigerian government revenues in terms of GDP per capita are decreasing. The economy is not growing. So in order for us to put a healthcare insurance scheme that meets the needs of even those 90 million people, that's a huge amount of poor people to be leaning on your healthcare system. I think, we have to think very, very carefully about what we're going to do, because there's a mass of Americans, even as rich as they are, that are still relying on government, the Medicare, Medicaid people. It's a huge amount of Americans that can't afford health insurance of any sort, so they have to rely on the government. So I think we're going to have to find the balance between government kind of sponsored or subsidized care and people that can afford insurance. Because like I said, the number of households at $9,000 and above is 100 million in India, but just 2 million in Nigeria. So it's tiny. And that's even households, 2 million households. I'll just ask, there's a lot more questions coming in, but I just don't want to take any more of the minister's time. I'm getting questions on every front from WhatsApp and from the chat, but I think that what we'll do is we'll take all those questions and maybe start a newsletter so people can email in their questions and we can have another discussion at another time. But for now, I'd just like to say big thank you to His Excellency, the Minister, who has been ably represented by his special assistant today, for taking out the time to talk about this topic that is very, very important to them and obviously very, very important to everybody here, especially in the light of COVID-19 as well. So thank you very, very much to everybody for your time. And thank you to the Special Assistant to the Minister as well, Abimbola Olufori, for your time. Thank you so much for joining us today. It made a huge difference to hear from the government side what you've been doing, and it's super exciting. And we all look to work with you further as this dialogue goes on. Thank you very much, everybody. Good afternoon.
Thank you. Good afternoon.